Hi, welcome to Erin's Craft Corner. Not really, I'm a nursing instructor, and something that I've seen really students struggle with is head-to-toe assessment and the documentation, mainly because it's a unique language that goes specifically for head-to-toe assessment, and as nurses, we know how important a good head-to-toe assessment is and how important the documentation is. So what I started doing was I started using magnetic words. And if you ever did magnet poetry, it would be where you had all the words on different magnets and you could make funny sentences. I thought, try this with assessment. So what I did was I went and bought 1/2 inch magnetic tape, so sticky on one side, magnet on the other. And then I grabbed some friends and colleagues and we made a list of all the different head-to-toe assessment things we have, hyperactive, hypoactive, alert-oriented, distended, all those kinds of things. And I made sure that they were words that we use in our clinical sites and that they're appropriate for our level of student. Then what I did, and that was about, I think, 24 to 28 point font, so it works really well on the half-inch strips of magnet, is I cut them apart. So I just cut them into rows, and then I put them directly on. So I peeled back the tape and put them on. You could do them one at a time, but I find it's easier to put a whole row, just faster. And sometimes I have to do a little trimming and cutting around. This then gets me these little guys, which are nice for putting everything together. And I have a whole grain set. I did 2 different colors, just mainly so I'd be able to tell them apart. But what that gets you is this, gets you, with the dry erase boards are nice because they're usually magnetic. You can put a person on there and put assessment data, and that could be a case study, or you could, with that you could easily change out. So, or you could have them try and put their patient on this board, working through those words before they put it down on paper. This part is really endless of the different possibilities that you could do. And I think it might really help our students learn to connect the head-to-toe assessment and the documentation and the correct terminology, because it's pretty important for them to get it right. If you have any questions, comments, or concerns, or any fun ideas that you guys have done, please let me know. I'm always willing to grow as an instructor and always looking for new things. Have a great night.